9 popular medications that can trigger rapid dementia. Every passing minute, the stark reality of dementia touches more lives, leaving families grappling with a future irrevocably altered. A staggering statistic reveals that every 66 seconds, another senior in this country receives the devastating diagnosis of dementia. By the time one finishes consuming the critical information presented here, an additional 20 families will have heard those same life-changing words. For a significant number of these individuals, the insidious cause was not the inevitable march of time or the natural process of aging. Instead, it was often a seemingly innocuous bottle resting on a bathroom shelf, a medication they had been confidently assured was entirely safe, perhaps even beneficial. Dr. John Myers, with a rich 15-year career dedicated to clinical practice, has witnessed this heart-wrenching scenario unfold with a frequency that is truly uncountable. He recounts the painful pattern: an individual renowned for their sharp intellect and vibrant mental acuity throughout their entire life gradually begins to lose their grasp on the intricacies of daily existence. The once familiar names of loved ones become elusive, important appointments slip through the cracks of memory, and even the well-worn drive home, traversed countless times over decades, suddenly feels alien and disorienting. Invariably, those closest to them observing these perplexing changes attribute it to the unavoidable process of just getting old. Yet, as Dr. Myers emphatically states, it often wasn't age at all. The true culprit frequently turns out to be a particular medication, a pharmaceutical agent that almost no one thinks to scrutinize. After all, it was prescribed by a trusted doctor and dispensed by a reputable pharmacy, lending it an unquestionable aura of safety. However, the latest, continually emerging research paints a very different and far more concerning picture. This contemporary scientific understanding consistently demonstrates that an entire class of ordinary, everyday drugs possesses the alarming capacity to severely impair one's memory and learning capabilities within a remarkably short span of a single year. Crucially, the vast majority of individuals currently taking these medications remain completely unaware of the profound cognitive impact they are experiencing. Today, Dr. Myers intends to meticulously guide his audience through an exposition of the 9 medications most definitively linked to rapid memory loss, presenting them in a carefully ordered countdown. The journey will begin with those drugs that are most frequently and quietly overlooked, progressing to the one he considers to be the most profoundly destructive of all. He urges particular attention to the medication at number 3, highlighting its widespread prescription to millions of seniors for conditions that, on the surface, appear utterly harmless. Yet, this very drug may be actively shrinking the vital memory centers of the brain at this very moment, silently, without a single overt warning sign alerting the user to its perilous effects. Before delving into this crucial information, Dr. Myers invites viewers to share their age and any daily medications they might be taking in the comments section. He emphasizes that he personally reads every single submission, as the demographic profile and health insights of his audience significantly influence the subjects he chooses to cover in subsequent discussions. Let us now embark on this essential exploration, commencing with the medication designated as number 9 on this critical list. One must not be deceived by its lower position, as this particular drug is an ubiquitous presence, found in nearly every medicine cabinet across America. Diphenhydramine, Benadryl. The 9th entry on this pivotal list is diphenhydramine, a compound that is instantly recognizable by its common drugstore moniker, Benadryl. This ubiquitous little pink pill is the immediate go-to for countless individuals seeking relief from a myriad of minor ailments. People instinctively reach for it to induce sleep when restlessness prevails, to quell the irritating symptoms of seasonal allergies, or simply to alleviate the nagging discomfort associated with a common cold. Its affordability, coupled with its readily available status on open pharmacy shelves, requiring no doctor's prescription, has cultivated a widespread assumption among the general public that it must be inherently gentle and entirely harmless. However, beneath its seemingly benign exterior, diphenhydramine performs a remarkably different and concerning function within the delicate architecture of the human brain. Benadryl is a prominent member of a pharmacological group known as anticholinergics. While anticholinergic may sound like a complex scientific term, it encapsulates a relatively straightforward yet profoundly impactful concept. These drugs actively block the action of a vital brain chemical called acetylcholine. Acetylcholine serves as an indispensable neurotransmitter, the primary messenger system that your brain employs to accomplish two fundamentally critical tasks: laying down the foundation for new memories and maintaining a state of sustained alertness throughout the day. As human beings advance in age, the brain's natural production of acetylcholine gradually diminishes. Consequently, the aging brain becomes increasingly reliant upon and strains every last bit of this precious chemical it has remaining. Therefore, a drug like Benadryl, which directly interferes with and blocks acetylcholine, exerts a significantly more profound and detrimental impact on the brain of a 70-year-old individual compared to that of a 30-year-old. The specific region of the brain that bears the brunt of this pharmacological assault is the hippocampus. This small, intricate structure, distinctly shaped like a seahorse, is the crucial hub where all new memories are initially formed and processed before they are effectively filed away for long-term storage. In the extensive course of his clinical practice, Dr. Myers has frequently observed patients who have habitually consumed a nightly antihistamine, often for years on end. Over time, these individuals would slowly but perceptibly lose their mental sharpness, experiencing a gradual dulling of their cognitive edge. Crucially, they would never once establish a connection between the insidious mental fog they experienced and the small pink pill positioned innocuously by their bedside. The scientific research, however, unequivocally establishes this link with crystalline clarity. A compelling paper published in 2023 within the esteemed Journal of Geriatric Cognitive Health presented a comprehensive study. It meticulously followed a cohort of older adults who were regular users of anticholinergic drugs, including diphenhydramine. The findings were stark and deeply concerning. These individuals exhibited a staggering 54% higher risk of ultimately developing dementia when compared to a control group of people who abstained from such medications. This represents more than half again. The normal risk of developing dementia, stemming from a substance that the vast majority of us casually regard as harmless as candy, routinely taking it without a second thought. In light of this critical information, here is the essential course of action to consider. It is imperative to diligently read the label of any product you consume for sleep purposes, as well as any medication explicitly marked with terms like PM, nighttime, or allergy relief. These designations frequently indicate the presence of diphenhydramine, often merely masked under a different brand name. If your primary reason for taking such a medication is to alleviate allergy symptoms, there are significantly newer generation antihistamines available, such as loratadine, commonly sold under the brand name Claritin. These advanced formulations are designed specifically not to cross the blood-brain barrier in the same manner as Benadryl, making them considerably safer for long-term use with respect to cognitive health. A paramount warning must be heeded. Never, under any circumstances, discontinue a prescribed medication on your own initiative. Always bring your concerns and intentions to your treating physician for professional guidance. However, it is high time to abandon the erroneous assumption that merely because a medication is available over the counter, it is automatically safe for the preservation of your memory. This critical realization marks the conclusion of our discussion on this medication. Proton pump inhibitors, PPIs. Our journey continues to the 8th medication on this crucial list, a class of drugs that your stomach may greatly appreciate for its immediate relief, but for which your brain silently bears a hidden cost. This category encompasses what are known as proton pump inhibitors, or PPIs. The most prominent and widely recognized names within this class include omeprazole, famously marketed as Prilosec, and esomeprazole, known to many as Nexium. These powerful drugs function by effectively shutting down the production of acid within the stomach. They are routinely prescribed and dispensed for a range of common gastrointestinal complaints, including persistent heartburn, bothersome acid reflux, and the uncomfortable burning sensation often experienced after meals. Patients frequently remain on these medications for extended periods, sometimes spanning years or even decades. The primary reason for such prolonged use is the almost immediate resurgence of symptoms, often with increased intensity, the moment they attempt to discontinue the drug. This rapid return of discomfort creates a powerful, often misleading perception that the medication is the sole guardian, the only thing holding the line against unbearable symptoms. Yet, there is a crucial piece of information that almost invariably goes unmentioned at the pharmacy counter, a critical detail that most patients never hear. Your stomach, in its intricate wisdom, absolutely requires a certain level of acid to efficiently extract vital nutrients from the food you consume. Chief among these essential nutrients is vitamin B12, a powerhouse vitamin that plays an indispensable role in safeguarding the delicate wiring of your nerves and, by extension, the intricate network of your brain. When stomach acid production is significantly suppressed for a prolonged duration by PPIs, your B12 levels will quietly and steadily decline, often without immediate overt symptoms. Similarly, the levels of magnesium and calcium, two other fundamental minerals upon which your brain cells depend to fire and signal cleanly and effectively, also tend to drop. When neurons are starved of these critical nutrients, the result can be misfires, episodes of profound confusion, and insidious memory slips that bear an uncanny resemblance to the early manifestations of Alzheimer's disease. In such cases, the real underlying cause is not a degenerative brain condition, but rather a nutritional deficiency, silently orchestrated by a medication that has been blocking the absorption of these vital components all along. The scientific community has provided compelling evidence to support these concerns. In 2016, a groundbreaking and extensive study published in the esteemed journal JAMA Neurology meticulously examined data from over 73,000 individuals aged 75 and older. The findings were stark. Regular users of PPIs exhibited a significantly higher risk, a 44% increased likelihood, of developing dementia compared to those who did not take these medications. Furthermore, the complexities and potential dangers of PPIs extend beyond mere nutrient malabsorption. Research has also indicated that these drugs can contribute to an elevation in the levels of amyloid beta within the brain. Amyloid beta is the notorious sticky protein that gradually accumulates and forms plaques characteristic of Alzheimer's disease, further implicating PPIs in the broader pathology of cognitive decline. Given this comprehensive understanding, here is the crucial step to take. If you find yourself taking a PPI every single day, this absolutely warrants an immediate and serious conversation with your doctor. Many individuals may be able to gradually taper down their dosage or transition to a gentler class of medications known as H2 blockers. A prime example of an H2 blocker is famotidine, widely sold as Pepcid, which is considerably less likely to negatively impact your cognitive functions. For a natural, supportive approach, chewing deglycyrrhizated licorice, DGL, a botanical compound known for its ability to coat and soothe the stomach lining, can effectively ease symptoms of heartburn and reflux without imposing any cognitive cost on the brain. The overarching objective with these medications should always be to utilize the lowest effective dose for the shortest necessary duration, rather than passively continuing a pill indefinitely purely out of habit. Bladder drugs, oxybutynin. Moving to the 7th position on our list, we encounter a class of medications prescribed for a common yet often unspoken problem, one that many individuals would rather not discuss openly due to its sensitive nature. This refers to the bladder drugs, and the particular compound that warrants close attention by name is oxybutynin, widely recognized by its brand name, Ditropan. This medication is frequently administered to seniors who contend with the distressing and often disruptive issue of a sudden, overwhelming, and urgent need to reach the bathroom. This type of overactive bladder can profoundly reshape an individual's entire day, dictating their activities, limiting their social engagements, and significantly impacting their overall quality of life. The relief that oxybutynin provides from these challenging symptoms is undeniably real, as is the profound embarrassment it spares countless individuals from experiencing. This immediate comfort makes it a highly appealing solution for many. However, the mechanism by which oxybutynin delivers this relief comes at a significant cognitive price. It functions by actively blocking acetylcholine, precisely the same vital memory chemical that diphenhydramine, Benadryl, also obstructs. What makes oxybutynin particularly concerning is its notable ease in crossing the blood-brain barrier, allowing it to readily penetrate the brain and position itself directly within the critical regions where new memories are painstakingly formed. This characteristic renders oxybutynin one of the more perilous medications on this entire list for an older adult, especially when it is consumed consistently, month after month and year after year. The cumulative effect can be profoundly detrimental. Scientific research further underscores these dangers. In 2019, the prestigious British Medical Journal published a pivotal study that meticulously investigated individuals over the age of 65 who had been taking potent anticholinergic drugs, such as oxybutynin, for a duration exceeding 1 year. The results were alarming. These individuals demonstrated a 49% higher risk of developing dementia, an increase that brings the likelihood close to a shocking 1 in 2. What troubles Dr. Myers most profoundly about these findings is the severe lack of adequate patient information. Almost none of the individuals participating in the study were ever explicitly warned about the potential cognitive side effects. They were simply informed that a pill would effectively calm their bladder. There was no mention whatsoever that this very same medication might concurrently be steadily dimming their mental faculties. Consequently, the ensuing mental fog, the difficulty recalling appointments, the exasperating experience of misplacing keys 10 times a day, or the frustrating inability to maintain the thread of a simple conversation are almost universally attributed to the inevitable process of getting older by both the individuals themselves and those around them. Rarely is the true cause traced back to the prescription medication until significant, often irreversible, cognitive ground has already been lost. If you are currently taking oxybutynin and have begun to notice a discernible slippage in your memory, it is absolutely crucial to take this observation seriously. It is vital to understand that you are not forced to make a stark choice between the health of your bladder and the preservation of your brain. Fortunately, newer pharmaceutical options are available that offer effective relief without the same cognitive risks. Drugs such as mirabegron, sold under the brand name Myrbetriq, operate through an entirely different pharmacological pathway and do not block acetylcholine at all. For the majority of older adults, these alternative medications can provide the same level of bladder control with a significantly reduced risk to their cognitive function and clarity of thought. It is imperative to proactively raise this discussion with your doctor during your very next medical visit. Statins. The sixth entry on our crucial list might arguably be the most surprising revelation for many, primarily because it represents one of the most widely prescribed drug classes globally. This refers to statins, a category of medications that plays a significant role in modern healthcare. Prominent examples within the statin class include simvastatin, known commercially as Zocor, and atorvastatin, widely recognized as Lipitor. These are among the most frequently prescribed medicines worldwide, a trend that intensifies particularly after individuals reach the age of 60. Their primary and undeniably important function is to effectively lower cholesterol levels, thereby substantially reducing the risk of debilitating heart attacks and devastating strokes. There is no denying that statins hold a legitimate and vital place in the lives of many patients, and it is crucial to understand that this discussion is by no means an argument against their appropriate use. What follows, however, is often the lesser-known half of the story, a crucial aspect that typically gets omitted from routine patient consultations. Cholesterol, a substance frequently demonized, performs far more than just influencing cardiac health. In fact, the human brain is composed of nearly 60% fat, and it critically utilizes cholesterol as a fundamental building block. Specifically, cholesterol is essential for constructing the myelin sheath, the protective, insulating layer that meticulously wraps around every single nerve fiber. This insulation is absolutely vital, as it ensures that electrical signals within the brain and nervous system can travel with optimal speed and pristine clarity. When cholesterol levels are lowered too aggressively, particularly by a potent statin, the brain can be inadvertently deprived of this essential raw material it genuinely requires for healthy functioning. It's important to distinguish that not all statins impact the brain in the same manner. The statins most frequently associated with cognitive issues are generally those that readily cross the delicate blood-brain barrier and easily penetrate brain tissue. A recent and highly relevant study published in 2023 in the journal Frontiers in Aging Neuroscience shed further light on this issue. The research revealed that adults over the age of 70 who had been on statins for a period exceeding 3 years exhibited a 26% higher rate of mild cognitive impairment. Furthermore, the study noted a dose-dependent relationship indicating that higher statin dosages were correlated with a steeper decline in cognitive function. Some patients vividly described terrifying blanks in their memory, a familiar name suddenly vanishing, a conversation they had just concluded completely erased from their recollection, or a route they had diligently driven for 2 decades inexplicably becoming unfamiliar and disorienting. The critical takeaway here is to understand that the impact of statins on the brain is not uniform across all types. For instance, pravastatin and rosuvastatin are generally considered safer choices for cognitive health because they do not cross into brain tissue as readily as some other statins. Therefore, if you have been taking a statin for several years and have started to notice the insidious creeping in of mental fog, increased forgetfulness, or episodes of confusion, this is not a symptom to be dismissed. Instead, it represents a genuine and pressing conversation that you must initiate with your doctor. This discussion could explore options such as a lower dosage or a potential switch to an alternative statin that is less likely to affect cognitive function. Crucially, this information is not a justification to quietly cease a medication that may be providing vital protection for your heart and cardiovascular system. It is imperative to collaborate with medical professionals to establish the correct plan, never attempting to modify or discontinue your medication regimen independently. At this juncture, if this vital information is resonating with you, connecting previously disparate dots in your understanding of health, Dr. Myers encourages a brief pause. Taking just 1 second to tap the like button can genuinely amplify the reach of this message, ensuring it reaches more seniors who desperately need to hear it and understand its implications. While you are engaging with the platform, he also invites you to share in the comments section the number of prescriptions you are currently taking. He reiterates his commitment to reading every single comment, valuing the insights shared by his audience. Now let us return to the crucial countdown, benzodiazepines. Arriving at number 5 on our list, we confront a class of medications that, while often prescribed with good intentions, carries significant long-term cognitive risks. The benzodiazepines. The names are familiar to many: lorazepam, widely sold as Ativan; diazepam, known by its brand name Valium; and alprazolam, more commonly recognized as Xanax. These powerful pharmaceuticals rank among the most frequently prescribed drugs in America, primarily for the management of anxiety disorders and as aids for sleep disturbances. Their therapeutic action is rooted in their ability to boost the activity of GABA, the brain's intrinsic calming neurotransmitter. By enhancing GABA's inhibitory effects, benzodiazepines effectively dampen a racing, overstimulated nervous system, bringing about a sense of tranquility. Initially, the experience of taking a benzodiazepine can feel akin to a profound rescue. The overwhelming grip of panic begins to ease. The relentless cascade of spinning thoughts gradually subsides, and elusive sleep finally descends upon the restless mind. However, as time progresses, the picture often undergoes a concerning transformation. A significant study published in 2022 in the British Medical Journal meticulously followed more than 8,000 seniors over an extensive period of 6 years. The findings were stark and deeply troubling. Those individuals who had utilized benzodiazepines for a duration exceeding 3 months exhibited a staggering 51% higher risk of developing Alzheimer's disease. The study further highlighted that the longer-acting benzodiazepines, such as diazepam, presented an even greater risk. This is primarily because these compounds tend to linger in the body for extended periods, accumulating within fatty tissues, including the highly lipid-rich environment of the brain itself. The fundamental effect of these drugs is a slow, pervasive chemical sedation that impacts the entire brain. Under their influence, the brain's capacity to learn new information becomes significantly impaired, its overall flexibility diminishes, and its cognitive processing slows down. Many individuals who take these medications describe a profound flatness, a persistent sensation of moving through a thick, pervasive fog, and a distressing feeling of no longer quite being themselves. Perhaps the cruelest aspect of benzodiazepine use manifests during the withdrawal phase. Abruptly discontinuing a benzodiazepine can trigger a severe rebound effect, where the original anxiety and insomnia return with twice the intensity. This often accompanied by intense agitation that can be genuinely dangerous, leading to a vicious cycle where the pill, despite its long-term harm, feels absolutely essential to the patient at precisely the moment it is exerting its most detrimental effects. Therefore, a critical rule emerges, one that carries immense importance. If you have been consistently taking a benzodiazepine for more than a few weeks, it is absolutely imperative that you do not stop suddenly. Such an abrupt cessation can lead to severe withdrawal symptoms, some of which can be life-threatening. Instead, it is crucial to work closely and collaboratively with a qualified medical professional to implement a slow, gradual tapering schedule, carefully reducing the dose over a period of several weeks or even months. Fortunately, gentler and safer alternatives exist for managing anxiety. Buspirone, for instance, is an anxiolytic medication that does not induce sedation or cognitive clouding. Furthermore, specialized forms of talk therapy, specifically designed to address insomnia and anxiety, can effectively restore a sense of calm and well-being without imposing the significant cognitive costs associated with benzodiazepines. Amitriptyline Elavil, coming in at number 4, is a singular pill, widely prescribed for a seemingly disparate array of 3 distinct problems, yet it silently carries one of the heaviest and most profound hidden burdens of all. This is amitriptyline, commonly known by its brand name, Elavil. Amitriptyline is an older generation antidepressant, a tricyclic antidepressant, TCA to be precise, that remarkably continues to be widely dispensed in contemporary medical practice. Its versatility is precisely why it has permeated so quietly and pervasively into various treatment protocols. It is prescribed for the alleviation of chronic nerve pain, as an aid for sleep disturbances, and even as a preventative measure to stave off debilitating migraines. This remarkable adaptability creates the deceptive impression of a do-everything pill, an all-purpose solution for a diverse range of ailments. However, beneath this veneer of versatility lies a critical and often overlooked truth. Amitriptyline is, in fact, one of the most potent anticholinergic drugs still in widespread use. This fundamental characteristic means that it aggressively blocks acetylcholine, the very chemical messenger that your brain's neurons absolutely depend on to communicate effectively with one another and to firmly lock in new memories. Its anticholinergic action is so profoundly strong that with consistent, long-term use, the adverse effect on memory ceases to be a rare or incidental side effect. Instead, it becomes an expected and almost inevitable consequence. In 2015, a landmark study published in the prestigious JAMA Internal Medicine Journal meticulously tracked the health outcomes of more than 3,400 adults aged 65 and older. The findings were deeply concerning. Those individuals who had accumulated the highest cumulative dose of anticholinergic drugs, such as amitriptyline, over a 10-year period demonstrated a staggering 54% greater chance of developing dementia. And perhaps the most distressing aspect of this revelation is the fact that almost none of these individuals were ever informed about this potential and profound cognitive risk posed by the pill they were taking. They received it for sleep or for pain relief, and then, slowly and insidiously, began to notice words becoming elusive, their memory gradually thinning, and their concentration fraying at the edges. These distressing changes were almost universally attributed to the natural, unavoidable process of aging. It doesn't even require a high dose to cause significant damage. A small nightly dose, consistently taken for years, can quietly and imperceptibly erode brain power, with no obvious warning symptoms until the cognitive loss becomes undeniably real and deeply impactful. If you or someone you deeply care about is currently taking amitriptyline, this represents a crucial conversation that is unequivocally worth having with a medical professional as soon as possible. Fortunately, for the management of nerve pain, alternative options such as duloxetine or gabapentin can provide comparable relief without carrying the same heavy anticholinergic burden. For those seeking assistance with sleep, melatonin or a very low dose of doxepin, which exerts a far gentler effect on this critical brain chemical, can serve as safer replacements. And for the treatment of mood disorders, newer generation antidepressants, such as sertraline or escitalopram, are generally considered much safer for the long-term health and vitality of the brain. Paroxetine, Paxil. This brings us to number 3, the medication Dr. Myers specifically urged us to watch for, precisely because it is routinely prescribed to millions of individuals for conditions that, on the surface, sound utterly harmless. This is paroxetine, widely recognized by its brand name, Paxil. Paroxetine stands as one of the most frequently prescribed members within a prominent family of antidepressants, known as selective serotonin reuptake inhibitors, or SSRIs. It is commonly employed in the treatment of both depression and anxiety disorders. On the surface, paroxetine appears to be a quintessential example of a modern, gentle therapeutic option, seemingly kinder and less burdensome than the older, more traditional psychiatric drugs. However, there is a critical detail concerning paroxetine that is rarely mentioned, yet it fundamentally distinguishes this particular SSRI from its counterparts. Paroxetine is the only SSRI that exhibits significant and potent anticholinergic activity. This singular pharmacological characteristic profoundly sets it apart from its siblings within the SSRI class, such as sertraline and escitalopram. Because of this, paroxetine actively reaches into and interferes with the very same acetylcholine system that every other concerning drug on this list has been slowly but surely chipping away at. Further scientific scrutiny solidifies these concerns. A comprehensive review published in 2021 in the journal Frontiers in Psychiatry meticulously examined older adults who were taking various types of SSRIs. The findings specifically highlighted that users of paroxetine demonstrated measurable and significant drops in short-term memory function, impaired word recall abilities, and diminished attentional capacity within the first 12 months of commencing the medication. More precisely, seniors taking paroxetine were 30% more likely to exhibit early signs of cognitive impairment compared to those who were prescribed other types of antidepressants. There is a profound and unsettling irony in this outcome, as the very purpose of prescribing this drug is to stabilize and steady the mind, yet over time, it can actively erode the very clarity and cognitive sharpness it was intended to protect. The solution to this particular concern is quite clear and straightforward. In the context of older adults, paroxetine is definitively a medication to be avoided whenever possible. The highly respected American Geriatric Society has formally placed paroxetine on what is known as the Beers list. This is a crucial, formal catalog of medications that are officially considered risky and potentially inappropriate for use in seniors. And paroxetine is included on this list for precisely these documented cognitive reasons. If you are currently taking paroxetine, it is imperative to initiate a conversation with your doctor about the possibility of transitioning to a safer alternative SSRI, such as sertraline or escitalopram. These alternatives are generally considered gentler on the cognitive system and do not carry the same significant risk of cognitive impairment. Additionally, providing natural support to your B vitamins, especially B12 and B6, can often help in naturally stabilizing mood, working synergistically with any medication changes you undertake. Antipsychotics. The drug class at number 2 is prescribed with such a profound lack of overt explanation that a significant number of individuals taking them have absolutely no idea what kind of powerful medication they are truly consuming. This refers to the antipsychotics. And this particular class of drugs troubles Dr. Myers the most acutely, precisely because so many patients taking them never knowingly or explicitly agreed to embark on a course of antipsychotic treatment. The specific names within this category include quetiapine, widely known as Seroquel, risperidone, sold as Risperdal, and olanzapine, marketed under the brand name Zyprexa. These potent medications were originally developed, extensively tested, and formally approved for the treatment of severe, debilitating psychiatric illnesses, such as schizophrenia and bipolar disorder. However, a deeply concerning trend has emerged. Today, these same drugs are frequently handed out off-label to older adults for a wide array of less severe conditions. These include general sleep disturbances, mild restlessness, and even the agitation that can, ironically, accompany dementia itself. What this represents is a startling misuse of powerful drugs originally intended for severe, life-altering mental illnesses. They are now routinely being utilized in private homes and, alarmingly, in nursing facilities to manage seniors who are simply confused, restless, or deemed challenging for an often understaffed and busy care team to manage effectively. The cost of this practice, both human and cognitive, is extraordinarily steep. A compelling study published in 2022 in Lancet Healthy Longevity tracked more than 25,000 older adults. The findings were unequivocally grim. Those individuals who were administered antipsychotics for behavioral symptoms exhibited a staggering 71% higher likelihood of suffering a worsening of their cognitive decline within a mere year. This increased risk was observed even in patients who had no documented history of dementia prior to initiating these powerful medications. Beyond cognitive decline, these same antipsychotic drugs are also known to significantly elevate the risk of other severe adverse events. These include an increased risk of stroke, the alarming potential for sudden cardiac death, and the induction of heavy sedation. This profound sedation, in turn, frequently leads to dangerous falls and subsequent hospitalizations, creating a cascade of negative health outcomes for already vulnerable seniors. Antipsychotics exert their primary effect by suppressing dopamine, a crucial neurotransmitter inextricably linked not only to mood regulation, but also to vital cognitive functions such as focus, planning, and memory formation. When dopamine levels are significantly reduced, the brain slows down dramatically, becoming unresponsive and often sluggish. This explains why individuals taking these powerful drugs can often appear dull, emotionally flat, and almost entirely absent in their demeanor, leaving their grieving families to watch as the essence of the person they love seems to fade, even as their physical presence remains directly in front of them. If you or a cherished loved one is currently taking one of these antipsychotic medications, the absolutely critical first step is to pose a direct and unequivocal question to the prescribing doctor. Inquire, why was this medication started in the first place? And is it truly, unequivocally necessary for my loved one's well-being? Or is it primarily being used for the convenience of managing their behavior? It is important to realize that for most behavioral symptoms, effective alleviation can often be achieved without resorting to any drug at all. This can involve implementing stable, predictable daily routines, reducing environmental noise and overstimulation, diligently treating any hidden or unrecognized pain, and meticulously optimizing light exposure and sleep hygiene. When medication is genuinely deemed necessary, adhering to the lowest possible effective dose for the shortest possible duration is paramount to minimizing potential harm. Far too frequently, families are never explicitly informed about the profound and devastating effects these powerful drugs can have on the brain. Consequently, they often witness a gradual cognitive decline in their loved one, mistakenly believing it to be an inevitable part of aging, when in reality, the root cause is a chemical intervention. Anticholinergic polypharmacy. Finally, we arrive at number 1, a revelation that is not a single drug at all, but rather arguably the biggest hidden driver behind every single distressing story and concerning statistic that has been recounted thus far. This is anticholinergic polypharmacy. This represents a subtle yet insidious danger that almost nobody explicitly names, and it is arguably one of the single largest, yet largely unrecognized, causes of drug-induced memory loss in older adults today. Throughout this discussion, you were likely anticipating the grand reveal of one final, ultimate villain, a single worst pill that stands above all others in its destructive capacity. However, the true worst-case scenario is far more nuanced and insidious than a singular culprit. It is the slow, cumulative, and additive effect of taking several anticholinergic drugs concurrently, often with no one, not even medical professionals, actively calculating and adding up the total anticholinergic burden on the patient system. The term polypharmacy simply and accurately refers to the practice of taking many different medications at once. The anticholinergic burden, then, is the combined collective weight and impact of all these drugs working in concert to block that one critical memory chemical, acetylcholine, within the brain. To illustrate this common yet perilous situation, picture a very frequent scenario. An elderly individual routinely takes diphenhydramine, Benadryl, every single night to help them fall asleep. Simultaneously, they might be taking oxybutynin every day to manage an overactive bladder. And to further complicate matters, they might also be on amitriptyline for the relief of chronic nerve pain. Individually, each of these medications, when taken in isolation, might only cause a small, barely perceptible dip in cognitive function or a subtle degree of memory impairment. However, when these anticholinergic drugs are taken together, their effects do not merely add up, they compound exponentially. The total burden they place on the delicate machinery of the brain climbs rapidly and dangerously. A significant study published in 2022 in the journal Age and Aging meticulously tracked the health records of more than 280,000 older adults. The findings unequivocally demonstrated that those individuals with the highest anticholinergic burden, that is, those taking multiple anticholinergic medications, had a staggering 120% higher risk of developing dementia within a 10-year period. This means their risk was more than double compared to those with a lower anticholinergic load. And perhaps the most unsettling discovery was that the vast majority of these affected individuals had absolutely no idea whatsoever that they were even taking anticholinergic drugs. No one had ever thoroughly explained this critical aspect of their medication regimen to them. When acetylcholine, the brain's vital memory chemical, is blocked from several different directions simultaneously, the brain does not merely idle or slow down slightly. Instead, a more profound and detrimental process begins. Neurons start to wither from disuse. Essential synaptic connections shrink and weaken, and the brain settles into a quiet, underpowered, and functionally compromised state. On cognitive testing, this state can appear almost identical to the characteristic deficits observed in Alzheimer's disease, creating a deeply misleading diagnostic picture. Here, however, lies the truly hopeful and empowering part of this entire discussion, and it is precisely the fundamental reason why Dr. Myers felt compelled to create this video. Drug-induced cognitive decline is, in many instances, often reversible, especially when it is identified and addressed early in its progression. When the anticholinergic burden is recognized and subsequently lifted, a remarkable transformation frequently occurs. Many individuals regain their clarity of thought, their renewed energy levels, and their precious memory functions within a matter of weeks or a few months. The human brain possesses a remarkable degree of resilience, far greater than we often give it credit for. However, this capacity for recovery is contingent upon one crucial action: removing the very substances that are actively harming it. The solution to this challenge does not require a miraculous intervention. Instead, it demands a careful, meticulous, and comprehensive medication review. It is imperative to sit down with your trusted doctor or your pharmacist and have them painstakingly go through every single prescription medication you are taking, every over-the-counter pill, and even every dietary supplement. The goal is to accurately calculate and add up your total anticholinergic load. There are straightforward, standardized scoring tools available that are designed to do precisely this, providing a clear numerical representation of the burden. Once the problem drugs have been identified and spotted, you can then, under professional medical guidance, safely taper off medications that are no longer needed, switch to safer alternative options, and ultimately create the necessary physiological space for your brain to begin its remarkable journey of recovery. This insidious phenomenon of anticholinergic polypharmacy represents the single most preventable threat to the aging mind on this entire critical list. And that unequivocally is precisely why it holds the #1 position. Now, Dr. Myers genuinely wants to hear directly from you, his audience. Of these 9 critical medication categories, which ones are currently residing in your medicine cabinet? Have you personally noticed the unwelcome creep of brain fog or heightened forgetfulness after starting something new? Share your experiences and insights below in the comments section. And crucially, commit to asking for a comprehensive medication review this very week. Your candid answer might very well be the vital piece of information that helps or even saves the next person who reads it, providing them with the awareness they desperately need. Before you depart, there is one more vital place where your body subtly hides its warnings, often years before anything else becomes apparent. While your medicine cabinet holds one set of clues, your hands, specifically your fingernails, hold another. Your fingernails possess the remarkable ability to flag potential trouble in your kidneys, your blood composition, and even the intricate workings of your nervous system, often long before any other overt symptoms or diagnostic tests do. Yet, the vast majority of people never know what specific signs to look for on their nails. That intriguing and crucial topic will be the focus of Dr. Myers' very next video. He promises to show you the 4 specific nail signs that are absolutely worth checking tonight. He signs off, "I am Dr. John Myers. Stay sharp, and I will see you there."